Assessment OSCE will be doing a normal birth delivery. We've got our PPE on, gloves and protective glasses. So we'll begin the scenario now. Knock, knock, knock. Good afternoon, with the paramedics. Hi, I'm Lucas. This is Dan.
Hello.
What is the reason we've been called out today? If I can take a good guess.
I'm expecting my third child today.
Third child, okay. So I just need to get some quick questions out the way. Is that all right?
Sure.
Has your water broken?
Yes.
What colour was it?
Straw colour.
Straw colour, excellent. Was there a mucus plug in the water?
Yes.
Excellent. How far apart are your contractions?
3 minutes apart.
3 minutes apart? Are they coming on strong?
Yeah, very strong.
Cool, so we're going to plan to have this baby soon then. Alrighty, do you have any previous birth complications? You mentioned you've had three, this is your third time pregnant?
Yes.
How many little ones do you have running around?
Two.
Two, okay, cool. So that's a gravidity of 3 and a parity of 2. So, did you have any complications while giving birth to the previous kids?
No.
Did they come with any were they born with any birth defects? Do you have any allergies?
No.
Do you have any pre-existing medical conditions?
No.
So at this point, I'm pretty happy to just come and do the home birth delivery. So I'll go ahead and get ready for that. Now we're going to start getting ready for the birth. Dan, first thing is, can I ask you to take a set of observations from Mum?
Sure thing.
All right, Mum, Dan's going to take a set of observations, make sure everything's happy and healthy. So we're ready for the delivery of the baby. So to prepare for our birth, we have our baby coming out kit, which has our blue paper towel in it, so we can absorb the fluid coming out. We've got our biohazard bag for the placenta when that comes out. We've got our clamps for the umbilical cord, and we've got scissors to cut it. We've also got some linens and towels, and that's just to make sure that baby gets dried off and stays warm. Next thing is I'm going to ask if we have any heating in the house that we can use. Mum, is there any heating that we can use? Make sure the room is nice and warm for baby.
Yes, we have a heater.
Heater? Cool. So we'll go out and we'll grab out the heater. We'll set it up just to make sure the room is hot enough or warm enough for baby when they come out. If we're sweating, baby's going to be really happy about it. Moving on, now we've got all that sorted, I'm going to ask Mum about the leading maternity carer and the antenatal plan. Mum, do you have a leading maternity carer?
Yes, she's on her way, but I can't reveal.
Okay, I assume that's why we were called today. So can you tell us about your antenatal plan, your birth plan? Were you planning on having a home birth?
Yes, I was.
You were. Were you planning on going to the hospital afterwards?
No, I was not.
No, you weren't. Do you have a preferred position you'd like to be in for birth?
Yes, on my back with my legs next to my shoulders.
Sweet as. So that's all sorted. Last thing is...
I have a blood pressure of 160/100, pulse of 70, and rest rate of 22.
So everything is a bit elevated, but that's to be expected because Mum is in a bit of a situation right now with giving birth. Last thing I'm going to ask you, Mum, is do you want any pain relief for your birth today? No? Cool. All sorted. Now we're just waiting for baby to come out. So we'll be communicating with Mum this entire time, making sure she's ready, see if she's ready to push, if baby's ready to come out. So Mum, are you ready to push? Is baby about ready to come out?
Yes.
Yes? Cool. I'm going to need to have a look at your pubic region, alright? Is it alright if I lift the sheet and I go and have a look?
Yes.
Cool. I'm also going to need to do some touching, some pressure, just to help deliver the baby. Is that also alright?
Yes.
Cool. So we've gotten consent from Mum, which is important to do in all these situations. So go ahead and lift the sheet up. I can see as I lift the sheet up that baby is already crowning. So I'll go ahead and then start exerting some pressure. Alright Mum, push, 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 push. I support the baby's head and shoulders with no traction. As baby comes out, I can see that the umbilical cord is not wrapped around baby's neck, so that there's no need to do anything about that. Now that baby's here, let's give baby a quick wipe down, wipe off the nose and mouth. Go ahead and pick baby up. Alright Dan, I'm just going to pass baby over to you, and you can put baby on a clean towel. There we are. And pass baby over to Mum as soon as possible so we can get good skin-to-skin contact. Now that baby's over with Mum, Dan, can you get baby's pulse, please? And before that, could you tell me what the time is?
8 o'clock.
8 o'clock. So 8 o'clock is our time of birth. So now that Dan's taking the pulse, that's because we're going to need to take an APGAR score. So APGAR consists of appearance, pulse, grimace, activity, and respiration. What's our pulse, Dan?
It's over 100.
It's over 100. So over 100 is considered healthy and normal for a baby. So our baby also has a nice pink healthy appearance, which is excellent. Grimace is also good, and she's crying, which tells me it's a nice healthy cry, which tells me that baby is breathing appropriately, so respiration is fine, and she's interacting with mum and really going for it, so her activity is also good. So baby gets a perfect APGAR score of 10. Now that baby's out, go ahead and go through the third stage. The first thing I'm going to ask my offsider Dan to get a second set of vitals. Just make sure mum's all healthy and happy. And next is mum, I'm going to need to check for excess bleeding. So is it alright if I go ahead and I lift up the sheet and I just have a look at you?
Yes.
Cool, so got a consent for that as well. Go ahead and lift up the sheet. There's no excess bleeding as far as I can see, that's all fine. So next we'll go ahead and we'll clamp the cord and cut the cord. So when we're clamping, get our clamps and do the first clamp 10 centimeters away from the baby. There we are. And then do the second clamp 5 centimeters away from the first clamp, or 15 centimeters away from the baby total. Let's go ahead and clamp that there as well. Now that we've clamped, we'll sort of wait around 3 minutes for the umbilical cord to stop pulsing. Well, that's just to signify that there's no more blood being pumped through it. Now that the umbilical cord stopped pulsing, we'll give the opportunity to cut it to a family member like Dad. So Dad will be more than happy to come and cut the cord. So Dad goes ahead and he does that now. Go ahead and pull that off.
Cool. I got 140 over 100,
Sweet.
70 for the heart rate and 20 for the wrist rate.
Sweet. So Mum's in a much calmer state than earlier. Now that baby's out, she's nice and healthy and happy. So now we've got the umbilical cord cut. Mum's healthy and happy. Go ahead and reassure and congratulate Mum. You did a great job, Mum. Congratulations on the healthy baby boy. How are you feeling?
Great.
Great. Awesome. Last thing is the placenta. Before I do that though, just do a second APGAR score for the baby. The baby scores a perfect 10 anyway. Now that we're waiting for the placenta takes approximately 30 minutes to get out. So we'll just say that 30 minutes has passed. Mum, now that it's 30 minutes, do you sort of feel that placenta coming out? Do you feel sort of the need to push again? You do? Awesome. So now to make sure that we get the placenta, we're going to get our yellow biohazard bag to put the placenta in, which we'll mark and put aside clearly. Go ahead and, Mum, I just need to lift it up so we can deliver the placenta. Is that alright?
Yes.
Cool. Go ahead and lift the sheet up again. Go ahead and push when you feel like it, Mum. And here comes the placenta. And push, 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 making sure not to apply any pressure or attraction to the placenta so it doesn't rip or tear, because I will need to examine it. Now that I have the placenta, I can go ahead and examine it, making sure that it's one piece, there's no chunks missing, and that's not smaller than I expect. This is because if there's any placenta left inside Mum, it can cause complications. So our placenta is all there, we're nice and happy with that. So go ahead and put it in our yellow biohazard bag. There we are. We'll mark it and we'll put it aside. So now that the placenta is out, I'm just going to need to check for excess bleeding one more time, Mum, is that alright?
Yes.
So it's no excess bleeding, Mum's all healthy and happy, go ahead and cover her back up. By now the leading maternity carer has arrived and she's happy with Mum and baby. I'm happy with Mum and baby, there's no outstanding medical conditions. Mum and baby, leading maternity carer, have decided to stay home as per their birthing plan, as per their antenatal plan, so we'll be happy to leave them at home today.